If you've been researching facelifts, you've probably come across two terms over and over: the SMAS facelift and the deep plane facelift. And you may have found yourself wondering, what's actually the difference? Does it matter in which one is right for me? Take a deep breath and prepare for the anatomical breakdown. The short answer is, the difference is significant, and understanding it, even at a basic level, will make you a far better informed patient when you walk into a surgeon's office. In this video, we're going to break it all down. We'll start with a quick look at the anatomy that makes modern facelifts work. Then we'll walk through the SMAS technique, the gold standard, step by step. In part 2, we'll cover the deep plane and what makes it unique. No jargon, no fluff, just the real information you need. The modern facelift, part 1, a comprehensive guide. The facelift has been around for over 100 years. The first one was performed in 1901. The surgical techniques for facial rejuvenation have evolved significantly over the last century, tightening the outer wrapping without doing anything about the structure underneath. Taking a closer look at the anatomical structure, imagine pulling a wrinkled t-shirt tight by stretching it at the sides. Sure, the wrinkles disappear, but you haven't fixed anything. The shirt is just under tension, and the moment you let go, it snaps back. Worse, it looks unnatural while you're pulling it. That's exactly what early facelifts did. The results were short-lived, and patients often ended up with that telltale pulled, windswept look. You could tell, everyone could tell. This discovery identified the structural layer that would redefine the entire procedure. They identified a layer beneath the skin called the SMAS. And once surgeons understood the SMAS, they realized that's what you need to address, not just the skin. To understand why modern facelifts work so well, you need to know how your face is actually built. A simple structural analogy helps us understand how these layers interact with one another. Think of it as a layered cake. Your face is built like a layer cake. On top is the skin, the frosting, if you will. The composition of these layers is what defines the youthful fullness of the face. Under the fat sits the SMAS, a sheet of fibrous tissue that's directly connected to your facial muscles. These anchors are essential for maintaining the overall integrity of the facial structure. When you're young, those hooks hold everything firmly up. As you age, they loosen and everything starts to slide down. The layers from outside in are skin, subcutaneous fat, then the SMAS, the superficial musculo-aponeurotic system. And then we come to the retaining ligaments that hold everything in place. And finally, the deep plane, where the facial nerve lives. That facial nerve is the most important structure in any facelift. It controls every expression you make, raising your brows, smiling, closing your eyes. An experienced surgeon knows exactly where it runs. Protecting it is everything. The structural difference between techniques is significant. A clear contrast between the older methods and the modern anatomical approach. And finally, the deep plane, where the facial nerve lives. That facial nerve is the most important structure in any facelift. The retaining ligaments are what anchor the SMAS to the bone. When they weaken, the face falls, resulting in jowls and deepening folds. A facelift's job is to reverse that descent, and the question is how deep the surgeon goes to do it. The SMAS facelift is the most widely performed modern technique. It's the workhorse, and in the right hands it produces excellent natural-looking results. In the precision of the operating room environment, the surgeon makes an incision that runs along the hairline, in front of and behind the ear, keeping scars hidden in natural contours. Then the skin is lifted as its own separate layer, like carefully peeling back the cover of a book. Think of this as the peeling of a book cover to reveal the pages underneath. In the SMAS technique, you lift the wallpaper first. That's the skin. Then you repair the walls underneath. That's the SMAS. Two separate jobs, done in sequence. It gives the surgeon precise control over both layers. Once the skin is lifted, the surgeon tightens the SMAS beneath it. This is where the resection and careful suturing of the tissue occurs. The SMAS is repositioned upward and backward, correcting the descent. Then the skin is redraped, the excess trimmed, and the incisions carefully closed. The final alignment of the tissue layers. The neck is addressed through the same incisions. If there are muscle bands or excess fat, those are corrected through liposuction or platysmoplasty. The results are genuinely impressive. Sharper jawline, smoother neck, corrected jowls. Recovery is typically 2 to 3 weeks before you're comfortable being seen publicly. Final results emerge over 3 to 6 months as swelling fully resolves. The SMAS facelift is best for patients in their 40s to early 50s with moderate jowling and neck laxity. Results typically last 8 to 10 years. Here's something important that often doesn't get talked about enough. The SMAS facelift has one meaningful limitation: the midface. Those deep creases from the nose to the mouth often see only modest improvement. Why? because the retaining ligaments that tether the cheek tissue are still in place. Take a closer look at the nasolabial fold region. Imagine trying to raise a tent that's staked too firmly to the ground. You can pull the fabric upward all you want, but the pegs holding it down will limit it. In a SMAS facelift, those tent pegs, the retaining ligaments, stay in place. As long as those anchors remain in place, the lift will always be restricted. The deep plane technique, as you'll learn, actually removes the pegs. For patients whose main concern is the lower face and neck, SMAS is often entirely sufficient. But for deep folds and mid-face descent, there's another technique. That's the deep plane facelift, and we cover it in full detail in Part 2. Before we wrap up, let's talk about risks, because any surgeon worth trusting will go through these with you in detail. The most common complication is a hematoma, blood under the skin flap. It happens in 1 to 3% of cases and requires drainage. Facial nerve injury is the most feared complication. Temporary weakness is common and resolves. Permanent injury is rare in skilled hands, but it's real. Other risks include healing problems, much more common in smokers. Smoking cessation for at least 6 weeks before and after surgery is non-negotiable. Choose a board-certified surgeon who specializes in facial surgery. Review real before and after photos. Never choose on price alone. Here's the bottom line. Modern facelifts work because they address the underlying architecture of the face, not just the skin. The SMAS technique delivers genuine rejuvenation, but it has limits, particularly in the mid-face. Understanding those limits helps you have a smarter conversation with any surgeon you consult with. Take a moment to consider the best options for your rejuvenation. The best facelift is the one that fits your face, your goals, and your stage of aging. Not the most expensive one, and not the one your friend had. In Part 2, we go deeper, literally. We cover the deep plane facelift, what it does differently, and why it's becoming the comprehensive standard. See you there. For more information and clinical insights, learn more about this and other stories on unbedsidemanners.com.